Hello, everybody, and welcome to our um, workplace webinar on how to prevent COVID-19 infection in the workplace. It's our third webinar of the series, making the workplaces safer. I'd like to introduce myself. I'm Dawn Pratt. I'm today's moderator, and it's also my pleasure to introduce our presenter for today's webinar, is Dr. Leon Jenisov. Dr. Jenisov is a public health physician with York Region Public Health. He joined York Region in April 2020. He was previously the chief physician at the Ontario Ministry of Labour. He's retired from the Ministry of Labour in 2019 after 35 years. Dr. Jenisov is a Royal College specialist in occupational medicine, as well as a certified family physician, recipient of the Queen Elizabeth II Diamond Jubilee Medal, and recipient of the Ontario Volunteer Service Award. I'd also like to introduce Vito Chafari, who will be assisting Dr. Jenisov in the questions and answers session. Vito's been working in public health for over 3 decades with extensive experience in many public health protection programs, including tobacco control, food safety and enforcement, and recently gained sufficient knowledge of the Reopening Act legislation as a result of his current position. Next slide. Okay, so just to note that this meeting will be recorded. During this meeting, you'll have the opportunity to contribute and ask questions. Questions will be gathered and sorted to avoid duplication and ensure the best response. Although your name will not appear on the screen to attendees, producers, and presenters, we do have access to them. If you have any questions about recording of this webinar, please contact hocommunications@york.ca, and the link is posted there on your slide. And next slide. Okay, so to ask a question, select the Q&A icon at the right side of the screen. You'll see it's circled in red there. Type your question in the inbox and then select send. Please identify your business sector when posting the question. Questions will be screened by the moderator, myself, and posed to the presenters. Questions and answers sessions will follow the main presentation. And thank you. So Dr. Jenisov will now begin the presentation.
Next slide, please. Thank you. So today we're going to be reviewing how to prevent COVID-19 infection in the workplace. Recently, we've moved to step 3 in the reopening of Ontario. However, it's important to continue to protect our workers in the workplace, to protect our clients, and to protect our businesses. So today we're going to review and have an understanding of how COVID-19 spreads, the control of COVID-19 risks in the workplace, and public health and workplace safety measures that you can implement in your workplace. So it's a review here, and basically we want to keep our Ontario workplaces safe, functioning, and continue with the reopening in step 3, and hopefully in the near future move beyond step 3. Next slide, please. So first, let's have an understanding of how COVID-19 spreads. That's the basics. Before I start, though, I'd like to, on behalf of York Region Public Health, thank all the employees and employers in our community who continue to practice excellent public health measures and stay safe while at work. And again, the purpose of today's webinar is to discuss what you need to know about how to prevent COVID-19 infection in the workplace. The first step to controlling risk in the workplace is to identify them. For COVID-19, the risks are related to how the virus spreads. COVID-19 can be spread in 2 main ways. The first, person-to-person contact by people that are in close contact with each other, or by surfaces or objects when people touch the face, contaminate their hands, and then they touch surfaces and the surfaces become contaminated, or the objects become contaminated. There are also several risk factors that help drive the transmission of COVID-19. As I mentioned, close contact, working closely with other people, is the highest risk factor. And other key risk factors for COVID-19 transmission include prolonged exposure. So that's when people spend more time with potentially infected people. That increases the risk of transmission. Crowded places, having more people in a space will increase the risk of transmission. Closed spaces, so indoor workplaces with less fresh air, working indoors is a bit riskier than working outdoors where there's more fresh air. And when people are breathing, forceful exhalation increases the risk. So any activity that causes people to breathe more deeply or heavily, such as vigorous exercise or singing. Now, the risk of severe health outcomes is not the same for all workers. The risk increases with age, and it's also higher for people with certain background medical conditions and people who are not vaccinated. Again, a good reason to encourage all your employees to get vaccinated. And it's possible for COVID-19 to be spread by people who do not have any symptoms. So please assume and act as if everyone is potentially infected when setting up controls. That's really the safest approach and consideration. Next slide, please. So let's look more in depth at controlling COVID-19 risks in the workplace. First, if you want to visit, you can visit Ontario's website for more information on developing your specific COVID-19 workplace safety plan. And as you develop your plan, you'll think through using different control measures to help manage COVID-19 risk. And I can be reviewing some of those different control methods now. But you'll find on the Ontario.ca webpage the guides to developing your COVID-19 workplace safety plan on the Ontario.ca webpage. So control measures are steps that you take to reduce the risk to your workers. With an infectious disease like COVID-19, your controls can help break the chain of transmission of the virus and reduce the risk of a workplace outbreak. In situations where one or more controls cannot be consistently maintained, it is especially important that other controls, a range of controls, or hierarchy of controls are in place. The hierarchy of controls, as illustrated in the pyramid on the slide, can help you choose the right controls for your workplace. This really applies to all workplace hazards, not just COVID-19. And always start by considering the most effective controls first. The higher the control appears in the diagram, in the pyramid on the chart, the more effective it is. The first three types of controls are more effective because once in place, they do not require additional worker action by the bioworker. So the elimination, substitution, engineering controls, and I'll elaborate on that in a moment. The effective use of administrative controls and PPE or personal protective equipment requires workers and other people to implement them properly and consistently every time. That's why the first three controls are a bit better to implement. So the levels in the hierarchy of controls, as you see in the pyramid, in order from most effective to least effective are elimination, so removing the risk of exposure and time entirely from the workplace. So one example here would be having everyone work at home all the time where possible, and that would help eliminate COVID-19 risk from a workplace. Substitution, so that's replacing a hazardous substance with something less hazardous. So you can do that with potentially a chemical hazard. For an infectious disease such as COVID-19, substitution is not really an option. The third step is engineering controls. These are physical changes you make in the workplace to remove hazards, either through ventilation or to separate workers from the hazard, including changes that support physical distancing and improved hygiene. So for example, you could build and install a plexiglass barrier, and we've all seen these, and that'll separate workers from customers or workers from workers. You can also ensure that proper ventilation systems are available, and good ventilation includes avoiding or minimizing recirculation of air, increasing the indoor to outdoor air exchange, air filtration systems, regular filter changes, and opening windows and doors where possible. And if you look on the Canada.ca website, they have a guide to indoor ventilation and COVID-19 on Canada.ca. Next slide, please. So the other two controls in the hierarchy are administrative controls. These are changes we make to the way people work and interact, including the use of policies, procedures, training, and signage. Examples of administrative controls include, for example, establishing contactless curbside pickup, following the capacity limits in the Reopening Ontario, which limits the number of people in a space at one time, scheduling staggered work shifts and breaks, establishing proper cleaning and disinfection protocols, providing education and training on proper hand washing techniques, and using a screening process for entry into the workplace and signage at the workplace. By the way, you want to have a look at the COVID screening guides on the Ontario.ca's website for businesses and clients and signages. They've been updated recently on the Ontario.ca website. The last in the hierarchy is PPE, or personal protective equipment. This is equipment and clothing worn by a worker to minimize exposures to hazards and prevent illnesses and infection. And so PPE is used to protect the worker, and it can include such things as surgical or procedure masks and eye protection. So it's very important in workplaces where people are working regularly close together and cannot avoid that 2-meter distance apart. That's recommended that they should be wearing surgical masks and eye protection if they're working closely together. The correct use of PPE can help prevent some exposures, but it should not take the place of other control measures. For example, screening, hand hygiene, use of barriers, and physical distancing where possible are all necessary. And the personal protective equipment is used alongside these other control measures. And finally, not mentioned here, but I want to keep emphasizing it, vaccinations. Next slide, please. So we moved into step 3. It's through your continued cooperation, diligence, and your efforts that we will keep York communities safe, York Region communities safe. As we know, on Friday, July 16, 2021, the Ontario government moved the province into step 3 of the roadmap to reopen. Step 3 of the roadmap focuses on the resumption of additional indoor activities with larger numbers of people and restrictions in place. There's a new provincial regulation for step 3. You want to have a look at that. Ontario Regulation 364/20, rules for areas at step 3. This lists the complete list of public health and workplace safety measures that are and restrictions that are required. You can see them here in the blue box. If you need clarification on the regulation, please consult with your legal counsel for your specific workplaces, or direct your questions to the province's hotline on Stop the Spread business information. They have a business information line to help you understand what's required in the different steps. So that's the number you see here on the screen, 1-888-444-3659, and that provincial hotline will help you. And then for sector-specific regulation requirements and restrictions, please refer to the regulation. Just briefly, I've got a couple of minutes, so I'll talk about the general safety measures in step 3. I won't go over all of them, but physical distancing has to be maintained for individuals outside of one's household. Indoor gatherings of up to 25 people are permitted with physical distancing of 2 meters in place. See, this 2-meter distancing requirement remains. Outdoor gatherings of up to 100 people are permitted with physical distancing of 2 meters in place. There's specific requirements for indoor and outdoor religious services with capacity limits. Face coverings, by the way, I want to mention, are required in all indoor public spaces with limited exemptions. Right, that includes indoor workplaces and outdoors when physical distancing cannot be maintained, or if wearing one is specifically required. There's distancing requirements for essential and non-essential retail businesses that are permitted to be open, personal care services, dining. And again, there's some additional restrictions. So you have to look at the regulation to get those specific restrictions. In addition, York Region businesses and workplaces are responsible for following the letter of instruction issued by York Region's Medical Officer of Health, which outlines some additional measures required of employers with respect to cooperating with York Region for the purposes of investigation and contact tracing measures and supporting vaccinations of your staff. And the website here lists a few more public health guidance and resource measures for employers on our york.ca website, COVID-19 for Business, the reopening page on ontario.ca, and as I mentioned, developing your COVID-19 workplace safety plan, which is required of businesses. So you can find that on the ontario.ca website. The next slide, please. As I mentioned, COVID safety plans are very important. Open businesses must prepare and make available the COVID-19 safety plan. A copy of the plan must be available to any person for review upon request and be posted where it would come to the attention of individuals working in or attending in the business. Again, for more information on creating your safety plan, please visit the Ontario website. You'll find a safety plan template, a checklist you can follow, and sample sector-specific safety plans. The safety plan must describe the measures and procedures that businesses have implemented or will implement to reduce the transmission of COVID-19. This includes, but is not limited to, screening, whether active or passive, depending on the situation, physical distancing, mask or face coverings, which are still required in many situations, cleaning and disinfecting of surfaces and objects, wearing of personal protective equipment, and preventing and controlling of crowding in the workplaces. This is very important, especially in workplaces that welcome the public, or we have workplaces where there's a lot of equipment and production lines packed together. Some businesses, places, and events have additional requirements that need to be included in their safety plan, including preventing gathering of crowds. And this is an important one, ensuring requirements for management of lineups are complied with. So where there are lineups to enter a workplace or say for checkouts, physical distancing has to be maintained. That has to be complied with. There are also requirements for mitigating the risk of interactive activities, whether exhibits or games or other factors. Again, look at the regulation for your specific sector requirement. Okay, next slide, please. So we'll now expand a bit on key public health measures and workplace safety measures as covered by the COVID-19 safety plan. So basics, where possible, work from home, except where necessary. And that's not available to all businesses, but where possible, that's good. Businesses and organizations that are open shall ensure that any person who performs work for the business or organization conducts their work remotely with some limited exceptions, unless the nature of the work requires them to be on site at the workplace. Physical distancing and line management that I've mentioned, businesses and places that are open must not permit patrons to line up inside unless they maintain a physical distance of at least 2 meters from others and wear a face mask or face covering with some exceptions. Businesses and places that are open must not permit patrons to line up outside unless they maintain a physical distance of at least 2 meters from others. Screening for workers in your workplace. Active screening is required. Screening helps keep infected workers and others from entering the workplace. Workplaces are required to actively screen all employees at the start of each day or each shift, as well as visitors that actually enter the work environment. And you have to ensure that no one enters the workplace unless it is confirmed they have completed the screening and the result of the screening is indicated that they're allowed to enter the workplace. As I mentioned, active screening covers COVID-19 symptoms. There's an active screening tool online at ontario.ca. It's just been updated, so have a look at that. And then also consider what records you may have to keep to show that active screening process is working, that you've been following it. At a minimum, you also have to have passed a screening of patrons entering the workplace. So this could mean you posting signs with clear instructions at all entrances that tell people how to screen themselves. The online sign on ontario.ca has been updated, so have a look at that and see if you need to download that and post that. The signs should include screening questions and instruct people with symptoms or high-risk exposures not to enter the premises. People are assumed to have screened themselves and follow the instructions. That's why you only have to have signs. That's past the screening, and you do not need to ask anyone to report the results of their screening for passive screening of patrons. So please, again, review the regulation for active screening requirements for patrons. That means non-workers to your specific sector. Businesses such as restaurants, personal trainings, personal services, and sports trainers. If the employer is holding a meeting or event space, they're also required to record the name and contact information of every patron that enters the establishment. So restaurants, personal services, sports trainers, the specific requirements, look at the regulation for that. Next slide, please. Just briefly, public health and workplace safety measures, additional ones, capacity limits. Different capacity limits apply to certain businesses. You have to look at the regulation for your specific sector to find the capacity requirements. Cleaning, disinfection. Open businesses must ensure that equipment, washrooms, locker rooms, change rooms, showers, and similar amenities that are accessible to the public are cleaned and disinfected regularly and frequently as is necessary to maintain a sanitary condition. Next slide, please. Personal protective equipment. Again, face masks and face coverings are required that cover the mouth, nose, or chin inside any business or place that is open, with limited exceptions. It's important to use masks properly. Eye protection is required in certain situations also. So have a look at that. Workers, as I mentioned, must wear the appropriate PPE that protects their eyes. If, while providing services, they're required to come within 2 meters of another person who's not wearing a mask or a face covering in an indoor workplace, or they're not separated by plexiglass or some other impermeable barrier. Just going to talk briefly about the COVID-19 rapid screening initiative. We're going to have another session on that, but small and medium businesses may qualify for the COVID-19 rapid screening initiative. And this program provides free rapid antigen tests for employees of small and medium-sized businesses through participating local chambers of commerce and other organizations. So this program will screen for asymptomatic cases of COVID-19 in the workplace that might otherwise be missed. That's going to help keep your workers safe, their families safe, and importantly, keep your businesses open. That's really the main goal of all this. Keep your businesses open, keep the workers safe, keep the family safe, keep the business open. So for more information, you want to look at the Ontario website. I'll just read it out to you. covid19.ontario.ca/get free rapid tests, or you can Google that, but it's on the ontario.ca website. Get free rapid tests. We'll tell you how to get that. Next slide, please. Thank you. So we're going to move into the questions and answer session, and there's some few preliminary comments, and I'll ask Don Pratt to take over now.
Thanks, Dr. Dennis. Oh, I hear a bit of an echo. Okay, so there we go. The first question that we have, is there any research done in terms of how much remote work has contributed to the prevention of COVID-19 transmission?
So I'm not aware of any of a specific research right now, but that's one of the methods of taking the risk out of the workplace. People are working at home. There's less people in a specific place, and it's safer and reduces the risk of being in a crowded workplace where transmission is more likely. Public Health Ontario, by the way, on Public Health Ontario website, they have a summary of research looking at risk in various settings. So you go to the publichealthontario.ca, and they have a specific COVID-19 webpage that has a lot of information with research, and you may be able to find some more information on that.
Thank you. That is the only relevant question that has been posted so far. Does anybody else have any questions that you'd like to pose? Okay, with that then, oh, just let me see if there's one additional one. Okay, so with that, then I'll just provide you with some, oh, there's another question. Is secondary protection required?
Sorry, I'm not sure what secondary protection means. If somebody could, if you can elaborate on that. We went through the hierarchy of controls that are necessary. So ideally, you want to implement all those control measures in the workplace. The first three are the highest and the most protective, and the last two, the administrative controls and personal protective equipment, they're important also to put in place. But the first three are engineering controls, elimination and substitution are the most effective. So again, for COVID-19, you're talking mostly about putting in place physical measures in the workplace to prevent infection. Let me just add again the importance of vaccine, people receiving both doses of vaccine. That's very important to prevent transmission, to protect workers, protect families, and really to keep businesses open. If you want to avoid having cases in the workplace of COVID-19, you lose that person from the workplace. You may potentially lose their close contacts from working in the workplace if they have to go into isolation. So there's a ripple effect that's going to affect your business. Right now, it's really important. We're getting close to the finish line. Who knows when that's going to be, but it's coming. But we need to have more people vaccinated to get there and to pass through step 3. So I encourage you as much as possible, support your employees in getting vaccinated. There are a lot of appointments now for vaccination. There's walk-in clinics for first doses. Please help your folks get vaccinated. That's really important. We're going to talk a little bit about the vaccine policy question. Don's just going to mention that right now about having a vaccine policy for your workplace.
Yes, so there was a question that came into a prior webinar about workplaces and policies and whether or not an employer has the right to ask about an employee's vaccine status. So just to respond to that, under Ontario's Occupational Health and Safety Act, employers are responsible to promote and provide a safe work environment. Businesses should focus on contributing to adhere to public health measures and reduce transmission, including promoting workplace testing, masking, physical distancing, proper cleaning, hand hygiene, etc. When considering issues regarding employees' vaccination status and workplace vaccination policies, employers should consult with legal counsel, their own legal counsel, to ensure compliance with the laws. Operators of long-term care homes, however, are mandated by the Ministry of Long-Term Care to have workplace vaccination policy. Under the immunization policies to be put into place at all long-term care homes in the province, each staff member must do one of the following: provide proof of vaccination of each dose, provide a documented medical reason for not being vaccinated, or participate in an educational program about the benefits of vaccination and the risks of not being vaccinated. There is a link to a provincial site for long-term care homes, which I can post. So that was a question that came up from last week that we wanted to just reiterate and respond. We have a few questions that have come in now, so just let me look through them. So the question around the secondary, I believe this is from the same person from the manufacturing industry. Masks are mandatory, but a secondary protection for the face, such as face shields or eyeglasses, mandatory. I think that was what was meant by secondary protection.
Yeah. So this is a requirement from the Ministry of Labor, where workers are closer. When you have in your workplace, if workers are going to be closer than 2 meters to each other, they have to be wearing eye protection. So both the face mask and eye protection, if they're regularly within 2 meters of each other. So that's really important to have both the face mask and eye protection, whether it's goggles, safety glasses, or a face shield. That's up to you, whatever's appropriate for your workplace, whatever's suitable for the workers. But when workers are regularly within 2 meters of each other, that's a Ministry of Labor requirement, is the mask, which is a public health requirement, plus the face shields. Or eye protection, or suitable eye protection. So yes, thank you for the question.
So just in follow-up to that, a secondary question is for workers who wear prescription eyeglasses, would that be accepted as eye protection for PPE?
No, definitely not. Prescription eyeglasses alone, unless they're prescription safety glasses, or regular prescription glasses are not acceptable for PPE. So either they have prescription safety glasses that are specifically CSA or ANSI approved safety glasses that are prescription, or they have goggles or safety glasses that go over the regular glasses, or one of the face shields.
Okay, so the second one is, or the next question is, with regards to events in private dwellings, are there restrictions on how food or beverage can be served? More specifically, phase 3 states that buffets are permitted. Are there conditions and restrictions to the buffet service? How about beverage service? Are satellite bars with a bartender permitted? Are pass around hors d'oeuvres allowed?
Vito, can you answer that question, please?
Yes, thanks, Doctor, and thanks, Don. If I understand the question, there's a couple of layers to the question. One is if the person issuing the question could confirm this is a household party or is this a party being held at an event center? So I'll answer as if it is in an event center, and then if Don gets an additional question, we can follow up. Are buffets permissible under step 3? Yes. They require a COVID plan to ensure that, the operator has a good sense of, how we're going to constantly clean and disinfect high touch surfaces and how you're going to control a lineup of people coming to get and self-serve their food. The other part of the question, if you can read the second part for me, Don.
Sure. So it says, are there conditions and restrictions to the buffet service? How about beverage service? Are satellite bars with a bartender permitted? Are pass around for hors d'oeuvres allowed?
The answer to all three of those is it's permissible. So whether you're going to get a drink or whether there is sort of a satellite bar, it is permissible. And people can come and get their drink under step 3. But once again, it's critical that a COVID plan reflect how you're going to manage the lineups, how you're going to manage high touch surfaces. Are you going to go to single service where possible? All those things need to be carefully considered as you organize those kinds of events.
Great, thank you. Another question is there any research done in terms of how much remote work has contributed to the prevention of COVID-19 transmission?
I think we covered that. The Public Health Ontario website, publichealthontario.ca, has a extensive compilation of research on COVID-19 and range of control measures. So you can take a look at that website and for that information.
The next question is, since it is at stage 3, is the capacity limit increased for personal service businesses?
Yeah.
Yes, thanks, Doctor, and thanks, Don. For personal service settings, the capacity limit is based on what you can host in your facility. There isn't a fixed number. It is what's the size of your facility, your usable space, and what you can, how many patrons you can have that are pre-registered, so people just don't show up, that you have to pre-register for an appointment, how many you can have where people are adequately spaced and there's adequate physical distancing at all times. And you need to post those capacities and make people aware, but there isn't a fixed number of 3 or 10. It's really based on the size and the usable retail space of your facility.
So just going back to the hospitality sector, and just a clarification then in terms of for those who are serving prescription eyeglasses, would they be accepted form of PPE? And then second to that, do servers serving indoors have to wear masks and shields?
Vito, can you answer that one?
The Ministry of Labor basically says, and they may change their position. I'm not aware, but as of today, if a staff person, including a waiter or waitress, is within 2 meters of an individual at a table who's not wearing a mask because they're eating, then you're required to wear appropriate PPE along with a face shield or eye protection. That is the position of the Ministry of Labor at this point.
In the education sector, how effective is wearing a lab coat covering, and is it required to be worn continuously? I'm guessing in place of a gown. Is it effective to wear a lab coat?
That's a well, so it depends on what the education setting is and what it's doing. I'm not quite clear on the setting here. I don't quite understand the question. I have to tell you. So
for the person who posted that question, if you'd like to clarify, I'll I'll restate it. The next from a Montessori school, are vaccines mandatory for workers in childcare?
So in Ontario, vaccines are not mandatory, although there's specific requirements for long-term care homes. Again, the best safety measure in the workplace, in addition to the public health measures, is vaccination. Right. So please encourage everybody to get vaccinated. But other than the specific requirements for long-term care homes that Don outlined, there isn't a mandatory requirement for vaccines, for the COVID-19 vaccine.
Okay, and then I do have a specific question from the entertainment industry sector. It's in a setting that has a lot of like touch and interaction with objects. So in this person's example, it's an escape room. Do you need, if you need to touch a lot or interact with a lot of objects to complete the game, how would they navigate something like this other than strict cleaning protocols? I'm wondering if there's a distancing consideration as well. I'm not sure how large escape rooms are.
So it's important to continue to have hand hygiene products, alcohol-based hand rub for the patrons to use, and remind the patrons to use it if they're going to be touching objects in the escape room. And yes, having a frequent cleaning disinfection program. The two of them together are necessary: hand hygiene and cleaning and disinfection. So you'll have to sort out in your workplace what's appropriate and what the timing is, but you'll need both of them.
Great. So I see two more questions. Can you touch upon the protocol when staff call in sick because they have symptoms?
So that, I mean, that's specific to your workplace. So if you look at the online workplace screening guide, then that provides advice on what people should be doing, whether they should be referred for testing or not. And then other than that, you have to develop your own specific workplace policies depending on your situation. But look at the online screening guide for workers, and that'll start you off. And then also there's additional information on our york.ca website for people with symptoms.
And just keeping track of the time, there's two more questions. One was around the lab coat question. The clarification is in private school education childcare, that's the sector wearing of a lab coat when screening students versus a gown. Do you need to wear this when the students who have been past screening once in the building? Like, do they need to continue to wear their gown over their coat, or their gown, or I guess their lab coats over their clothes?
So, I mean, the first thing is the specific policy of the school or education institution. So you have to look at that. But there isn't a specific general requirement at screening to have specific clothing. Certainly, if it gets contaminated, you have to be able to clean it and change it. But you'll have to look at the specific policies of the educational institution.
And finally, is there a rough idea or any insight of when masks in the workplace may no longer be required after step 3?
Not yet, but the sooner people get vaccinated, and the more people that get vaccinated and have both doses of the vaccine, the sooner we'll be out of step 3. But when, I don't know.
Okay, so just a few final comments before we wrap up, and I recognize we're 10 minutes over time. While we're all ready to get back to business as usual, we still have a role to play in the fight against COVID-19, as we've been discussing. Under Ontario's Occupational Health and Safety Act, employers are responsible to promote and provide a safe work environment, as we've said. And just to let you guys know that the webinar recordings and slides will be available on our website. I did publish that link. It's york.ca/COVID-19 for business. And we provide the businesses with the information to help keep our businesses open and our workplaces and communities safe. And that's the conclusion of our webinar. I'd like to thank Dr. Chernisov and Vito Chafari for leading and facilitating this. And thank you all very much.
Thank you, Don.
Thank you.